Hi everyone, myself Sukhman Singh and I'm the lecturer in BSLP department and today my topic of discussion is tinnitus. Introduction. The word tinnitus is derived from the Latin word tinere meaning to ring or a ringing. Tinnitus is defined as an unwanted auditory perception of internal origin, usually localized or rarely heard by others. It is most prevalent between 40 and 70 years of age, has a roughly equal prevalence in men and women, and occasionally can occur in children. So the definition: tinnitus is defined as a perception of noise or sounds in the head or ears in the absence of an actual stimulus. Tinnitus is associated with many different medical pathologies, including hearing loss, acoustic trauma, closed head injury, disease processes, etc. So tinnitus as a symptom. So there are two types of tinnitus that physician and patient opt to experience. So first is objective tinnitus. So it is when the patient tinnitus can be heard by physicians, certain conditions are suspected. This is called audible tinnitus, where it corresponds to blowing, respiration, pulsating, rough in character, or when there is a rapid succession of duckling or popping sound. Conditions associated with objective tinnitus are patient with Stitching tube, cardiac vascularities pulsating and synchronous with heartbeat, vascular tumor in middle ear muscle contraction. Objective tinnitus is quite rare when one considers the number of patients seen with this complaint. Second one is subjective tinnitus. It is most frequently encountered problem. Here only patient can hear the tinnitus. Conditions associated with subjective tinnitus are otological disorders, most common cause in any age group 90%. SNHL is common finding. SNHL stands for sensorineural hearing loss. Heller, ME, and Bergman, MT, and all 62, 73, 93 in 1953 has given condition associated with tinnitus. Otosclerosis, Meniere's disease, Laryngom's syndrome, pressure or neuritis of auditory apparatus, brain tumor, eight nerve tumor, aneurysm, otitis media, acute, chronic, suppurative, and non-suppurative. Otitis interna, acute and chronic, conductive, mixed, and sensorineural, normal hearing with discrete frequency defect, nasopharyngeal diseases, Stretching tube, sinusitis, pharyngitis, mucosal hypertrophy, hyperplasia, tumor, infection of lymphoid tissue. So these are some of the reasons why which are considered in the subjective type of tinnitus. And now move to other reasons are dental pathology, intoxications, allergy. So these are all the reasons of subjective tinnitus. Bell palsy, psychosis, otic herbs, foreign body, trauma to ear, head injury, meningitis, and now the tinnitus in clinical practice. So Sponline gave figures that 50% in patients with sudden hearing loss, 70% in those with presbycusis, 30 to 90% in toxicity patients, 50 to 90% in chronic acoustic trauma patient, and 100% patients suffering from Meniere's disease. So this is a questionnaire which we generally used, which we give to the patients to give their views regarding their tinnitus, which kind of tinnitus present in which ear, which sound they are hearing, which kind of sound is this, what's a pitch. So these are the questions which we generally have in our questionnaire. Another questionnaire which was also known as a tinnitus handicap inventory, which was given by Newman and Jacobson, and it is usually used in the clinical setup. This also contains so many types of questions. So the patient have to fill this and continue. There are forms of tinnitus management include biofeedback, hypnosis, electrical stimulation, relaxation therapy, counseling, habituation therapies, and tinnitus masker. So if we talk about the counseling, avoid loud noise, avoid total silence, have blood pressure checked, avoid stimulants such as coffee, colas, and tobacco, decrease intake of salt, which impairs blood circulation, exercise daily to improve blood circulation, relaxation exercise. Note, although there is no cure for tinnitus, scientists and doctors have discovered several treatments that may give you some relief. Not every treatment works for everyone, so you may need to try several to find the ones that help. And these are some of my references. So, thank you.